Hello, my friends. I'm Dr. Rachel Storms, and today I want to give you something most people never get in a short doctor's appointment: a complete, honest picture of what vitamin B12 deficiency actually looks like in a body over 65, why it is so frequently missed, and what you can do about it starting today. This is not a general video about vitamins. This is a specific clinical walkthrough of 7 signs that your body uses to signal this deficiency, signs that are routinely dismissed as normal aging, misattributed to other conditions, or simply never connected to a nutrient that costs less than $10 a month to correct. I want to start with a woman I will call Martha. Martha is 73 years old. Over the course of about a year, she developed a progressive loss of balance. She was stumbling in the dark. She was holding walls. Her family noticed she was slower, less sharp in conversation, and that her mood had shifted in a way that was hard to name but unmistakable to people who loved her. 3 physicians told her and her family the same thing: this is what getting older looks like. It took a 4th physician, who ordered a complete metabolic panel including a test most doctors do not routinely check, to discover that Martha's B12 was critically depleted. Within 3 months of treatment, her balance had improved, her cognition had cleared, and her family had their mother back. Martha's story is not unusual. It is, in my clinical experience, far more common than the medical system is structured to detect. In this video, I am going to walk you through 7 specific signs of B12 deficiency. I want to flag 2 things before we begin. Sign number 4 is something many of you will recognize from your own morning routine, and sign number 7 is the one most physicians overlook until damage has already occurred. Stay with me through the entire video, because the section after the 7 signs contains what I consider the most important piece of information in the whole discussion: why taking a B12 supplement may not be solving the problem even if you have been taking it faithfully for years. The first sign is the one most people associate with B12 deficiency when they have heard of it at all: tingling, numbness, or a pins and needles sensation in the hands, feet, or lower legs. The medical term is paresthesia, and it is the early signal of peripheral nerve damage caused by B12 depletion. To understand why this happens, you need to understand what myelin is. Every nerve fiber in your peripheral nervous system, the nerves that run from your spinal cord out to your extremities, is wrapped in a protective sheath called myelin. Myelin is the electrical insulation of the nervous system. It allows nerve signals to travel at full speed and without interference. Vitamin B12 is essential for the synthesis and maintenance of myelin. When B12 is deficient, myelin degrades. Nerve signals become unreliable. And the first signals to become unreliable are often the sensory ones, which is why tingling and numbness in the extremities is the earliest neurological warning. What makes this sign dangerous is that many older adults dismiss it as poor circulation, as arthritis, or as something that comes with age. Sometimes it is those things. But when tingling is persistent, when it involves both hands or both feet symmetrically, when it is worse in the morning before you have moved around, and when it is accompanied by any of the other signs I am about to describe, B12 deficiency needs to be on the diagnostic list. The damage to myelin, if caught early, is largely reversible. The longer the deficiency continues undetected, the more the reversal becomes incomplete. The second sign is what I call the cognitive shadow, and it is the one that generates the most distress in patients and families because of what it resembles. The specific presentation includes word-finding difficulty, slowed processing speed, difficulty holding multiple things in working memory simultaneously, and a dulling of mental sharpness that the person themselves often notices and finds frightening. The reason this matters so much is that it can be clinically indistinguishable from early Alzheimer's disease on casual observation, and it is frequently diagnosed as such without the B12 level ever being checked. The distinction I want you to carry out of this video is this: B12-related cognitive symptoms tend to develop over months rather than the gradual years-long progression typical of Alzheimer's. They are accompanied by other B12 signs: the tingling, the fatigue, the mood changes I will describe. And critically, they are associated with specific findings on brain imaging, white matter changes, and in severe cases, cortical volume loss that are at least partially reversible with treatment when caught before they have become extensive. A landmark study from the Oxford Project to investigate memory and aging found that participants with low B12 levels at baseline had significantly greater rates of brain volume loss over the following years. The brain is physically smaller in people with sustained B12 deficiency. Treatment slows that process. This is not a subtle or marginal finding. It is a reason to check B12 before diagnosing dementia. The third sign involves balance and what happens to your coordination in conditions of reduced visual input, such as walking in a dark hallway at night or stepping into an unlit bathroom. The mechanism is a condition called proprioceptive failure, and it is one of the most direct pathways from B12 deficiency to fall risk. Proprioception is your body's internal GPS, the constant stream of signals from nerve endings in your muscles, joints, and skin that tells your brain where your limbs are in space without you having to look at them. When myelin degrades in the spinal cord pathways that carry these signals, proprioception becomes unreliable. You cannot accurately sense where your foot is landing. You cannot feel whether the surface beneath you is level. You compensate unconsciously by relying more heavily on visual input. And when the lights go out, that compensation disappears. The stumbling in the dark, the unsteadiness that seems to come from nowhere at night, the need to touch a wall when you walk without lights, these are classic presentations of the spinal cord involvement in B12 deficiency, a condition called subacute combined degeneration. If you recognize this pattern, it warrants prompt evaluation. The fourth sign is a change in the appearance of the skin, specifically a pallor that is often accompanied by a subtle yellowish tinge, sometimes described as a washed-out or waxy quality to the complexion. This is the sign I mentioned at the beginning that many of you may have noticed in the mirror this morning without connecting it to anything specific. The mechanism is megaloblastic anemia. Vitamin B12 is essential for the normal maturation of red blood cells in the bone marrow. When B12 is deficient, red blood cell precursors cannot divide properly. They become enlarged and abnormal, what we call megaloblastic cells, and they are released into circulation prematurely, if at all. These abnormal cells do not carry oxygen efficiently, and there are fewer of them. The reduced red cell count produces pallor. The breakdown of the abnormal cells releases bilirubin, a yellow pigment, which produces the faint yellowish tinge that is characteristic of this type of anemia. If you look at your hands and the inside of your eyelids and notice they look paler than they used to, and if your complexion has taken on a slightly washed or yellowish quality that is not explained by your sun exposure or your diet, this is a signal worth investigating. The fifth sign is one that you can check right now in 30 seconds while watching this video. Look at your tongue in the nearest mirror or use your phone camera. A healthy tongue has a mildly textured surface covered in small projections called papillae that house the taste buds. In B12 deficiency, these papillae atrophy. The tongue becomes unusually smooth, almost glassy in appearance. In some people, it is also red and sore, a deep beefy red rather than normal pink, and some people describe a burning sensation on the tongue or in the mouth that has no obvious cause. Along with these changes in texture and color, the taste buds embedded in the papillae are affected, and many patients report that food has lost flavor, that everything tastes slightly different, or that there is a persistent metallic taste. The medical term for this tongue presentation is glossitis, and while it has other causes including iron deficiency and certain infections, in the presence of other B12 symptoms, it is a significant physical finding that adds weight to the case for investigation. I find this sign particularly useful because it is objective and visible. It cannot be explained away as anxiety or aging, and it is something the patient can see and report specifically to their physician. The sixth sign is breathlessness without exertion, and I want to be precise about the quality of this symptom because shortness of breath has many causes, and they are not all equivalent. The breathlessness associated with B12-related anemia is a specific kind. It is most noticeable during activities that would not previously have caused it. Climbing one flight of stairs, carrying a bag of groceries from the car to the kitchen, walking at a pace that used to feel easy and comfortable. You arrive and find yourself breathing harder than expected, needing a moment to recover, perhaps with a slight sense of tightness or heaviness in the chest. This is the oxygen transport deficit of megaloblastic anemia making itself felt under mild demand. The blood simply cannot carry enough oxygen to meet the muscle's needs when those needs increase. Combined with the fatigue that is present even at rest, this pattern of exertional breathlessness should prompt a red blood cell evaluation. And if iron supplementation has been tried for fatigue without meaningful improvement, it is essential to check B12 because iron cannot correct megaloblastic anemia. The bone marrow needs B12 to produce functional red cells regardless of iron availability. The seventh sign is the one I described as the most dangerous, the one most frequently overlooked, and the one that by the time it appears has usually been preceded by months of the other signs being missed. It is visual disturbance, blurring, difficulty distinguishing contrast, or a dimming of central vision that develops gradually. The mechanism is optic nerve involvement. The optic nerve, which carries visual information from the retina to the brain, is a heavily myelinated structure, and in severe or prolonged B12 deficiency, myelin loss in the optic nerve produces a condition called optic neuropathy. It typically begins with subtle difficulty with contrast sensitivity, the ability to distinguish edges and fine detail in low contrast settings. It progresses to central scotomas, blind spots in the center of vision that the person often notices as a blurring or smearing of text. It can eventually involve color vision, with colors appearing washed out or faded. Because vision changes are commonly attributed to cataracts, to macular degeneration, or simply to aging eyes, B12 is rarely the first thing checked. But in any older adult with unexplained visual changes who has not had B12 assessed, it absolutely should be. Optic neuropathy from B12 deficiency is one of the few causes of progressive vision loss in older adults that is genuinely reversible, but only if treatment is started before the nerve damage becomes permanent. Now I want to give you the piece of information that I consider the most important in this entire video because it explains why a significant proportion of older adults who are already taking B12 supplements are still deficient. This is the section I asked you to stay for, and it is the section most likely to change what you do next. The issue is absorption, and specifically a protein called intrinsic factor. Vitamin B12 from food and from most oral supplements is absorbed through a two-step process that requires intrinsic factor, a protein produced by specialized cells called parietal cells in the stomach lining. Intrinsic factor binds to B12 in the stomach and escorts it to specific receptors in the lower small intestine where absorption occurs. Without intrinsic factor, dietary B12 and supplemental B12 in standard oral forms passes through the digestive tract largely unabsorbed, regardless of how much you consume. After 65, a very common condition called atrophic gastritis, which involves the gradual thinning and loss of function in the stomach lining, reduces parietal cell activity and therefore intrinsic factor production. In some older adults, this reduction is partial. In others, it is near complete. The result is that a person can have a diet rich in meat, fish, eggs, and dairy, all excellent B12 sources, and still develop severe deficiency because the delivery mechanism is compromised. This is also why taking a standard oral B12 supplement often fails to correct deficiency in older adults. The supplement is in the same form as dietary B12 and faces the same absorption barrier. There are two solutions. The first is sublingual B12, which dissolves under the tongue and is absorbed directly through the mucous membranes into the bloodstream, completely bypassing the digestive absorption mechanism that requires intrinsic factor. Sublingual methylcobalamin, the active form of B12, at doses of 1,000 micrograms daily, can correct deficiency in many patients with partial intrinsic factor loss. The second and most reliable solution is intramuscular injection, which delivers B12 directly into tissue where it is absorbed into circulation with complete bypassing of the gut. For patients with severe atrophic gastritis or with a condition called pernicious anemia, in which the immune system attacks and destroys parietal cells, injection is the only reliable route. If you have been taking oral B12 and your levels have not normalized, this is the conversation to have with your physician. There is also a second class of medication that contributes to B12 depletion through a separate mechanism, and it is worth naming because it is extremely commonly prescribed in older adults. Proton pump inhibitors, which include omeprazole, pantoprazole, and lansoprazole, suppress stomach acid production. Stomach acid is required to release B12 from the protein bonds in food before intrinsic factor can bind to it. When acid is chronically suppressed, food-bound B12 is never released and cannot be absorbed. If you are taking a proton pump inhibitor daily, your B12 needs to be monitored. And if you are taking both a proton pump inhibitor and metformin, the risk compounds significantly because metformin also reduces B12 absorption through a calcium-dependent mechanism in the small intestine. Let me now give you the specific language to use at your next medical appointment, because knowing the right test to ask for makes an enormous practical difference. The standard B12 test, serum B12, has a significant limitation. It can appear normal or borderline even when functional B12 deficiency exists at the cellular level, because it measures total B12, including forms that are bound to proteins and metabolically inactive. The test that catches deficiency that serum B12 misses is methylmalonic acid, abbreviated MMA. Methylmalonic acid accumulates in the blood when B12 is functionally deficient because B12 is required to metabolize it. An elevated MMA with a borderline or low normal serum B12 is strong evidence of functional deficiency. Ask your physician for serum B12 and methylmalonic acid together. Some physicians also add homocysteine, which also accumulates with B12 depletion. That combination gives the most complete picture. In terms of dietary sources, the foods with the highest B12 content are clams and other shellfish, beef liver, sardines, trout, salmon, tuna, eggs, and dairy products. These are excellent sources, but I want to be honest. For older adults with atrophic gastritis, dietary emphasis alone will not correct an established deficiency. Dietary optimization is a reasonable long-term strategy for maintenance once levels are restored. But if you have symptoms and a confirmed deficiency, food alone will not get you there fast enough. You need the sublingual or injectable route to correct tissue levels, and then dietary sources can help maintain them. One final thing I want to name, because it connects to something I see in clinical practice constantly: the mood, anxiety, and emotional changes associated with B12 deficiency, the irritability, the low mood, the anxiety that seems to come from nowhere, are frequently treated with antidepressant or anxiolytic medications before anyone has checked B12. I want to emphasize it again here because it is one of the most common and most consequential diagnostic oversights I encounter. If you or someone you love received a new psychiatric diagnosis after 65, before accepting that diagnosis fully, please ensure that B12 has been comprehensively assessed with MMA, not just a serum B12 that reads borderline normal. A partial response to antidepressant medication in the presence of undetected B12 deficiency is not a reason to add more medication. It is a reason to test more thoroughly. Do not let a simple, correctable vitamin deficiency steal your balance, your memory, your vision, or your independence. Those are not inevitable losses. In many cases, they are the consequences of a deficiency that has been present for years, that has been attributed to aging, and that could have been identified and treated with a blood test and a supplement that costs less than a week of groceries. If this video gave you something useful, the next step is to share it with someone you know who has been told their fatigue, their stumbling, or their low mood is just getting old. It may not be. And if you want to understand one more piece of how nutrition affects your health in ways that most appointments never cover, my video on the 4 foods that clear lung mucus in seniors connects to this topic in a way that will surprise you. The relationship between B12, inflammation, and respiratory health is closer than most people realize. Watch that video next.